What's new in migraines? It's an exciting time because there is something new in migraine management that women should know about. So I'm a migraine sufferer, probably like many of you, and truthfully, over the course of my lifetime, it's really impacted my quality of life. I've missed many days of work because of migraines, and I tell my patients now that the best thing about chemotherapy-induced menopause has been that my migraines have virtually gone away. We know they're much more prevalent in women, and we know that hormonal flux, periods of time where there's hormonal changes, can really exacerbate the frequency and severity of migraines. Many women have what's called menstrual migraines, which we know the onset is in the week prior to their menstrual cycle, when estrogen and progesterone levels are rapidly changing. What we also know is that women self-medicate and try to manage migraines and don't bring them to the attention of physicians. And why that's an issue, if you're a consumer and you're suffering from what you just think are regular headaches, first of all, they're more likely migraines. You should also kind of pay attention if they have any cyclic variation with your menstrual cycle, because that's really a hallmark of having menstrual migraines, and really you're probably having migraines. You should bring them to the attention of your physician because there are great therapies available. In fact, my daughter's a migraine sufferer. She's even been more severe than I have been. And over the course of the years when we both were getting frequent migraines, we used to say that the three best inventions of all time were contact lenses, tampons, and a medication called Maxalt, rizatriptan, because it's a very effective abortive agent for migraine management. And there's a whole class of them. But as a consumer, as a woman, if you're having headaches, what we know is that as opposed to taking over-the-counter medications too frequently, or as opposed to taking something called Fioricet or even narcotics because the pain is so bad, that's really not the best therapy for migraines. And that really these drugs, they're called triptans, are highly effective for treatment of an acute migraine as abortive therapy. And the earlier you get the triptans in, the better. They're much more effective if you take it right at the onset of your headache. But in women who are really having frequent migraines that we call, instead of just episodic migraines and menstrual migraines, now they're having what we call chronic headaches. They've really gone into more than 6 headaches per month. On average is what we use as the criteria. You should really be someone who is talking to your clinician about preventative medications. So something that you take every day to prevent you from having as frequent or severe migraines. Now, in the past years, the medications that we used was something called Topamax. We've been using beta blockers, which are a blood pressure medicine. We've been using tricyclic antidepressants. And there is data about all of them, seizure medications, Topamax, Depakote, beta blockers, nortriptyline, amitriptyline. There's data that these medications can be very effective at decreasing the frequency and severity of migraines. But the problem is they have side effects, and actually they often have limiting side effects, and people don't typically want to stay on them. The vast minority actually stay on them long term. What's great news for migraine sufferers now is that, again, translational science, bench research, has now led us to a really good understanding of the pathophysiology of migraines. And we've really identified a molecule that is involved in the migraine cascade and is associated with the pain that is so terrible in migraine sufferers. This class of medication is called CGRP inhibitors. There's 3 of them now, FDA approved on the market for migraine prevention. They are injectable medications that patients self-deliver on a monthly basis. And I can tell you that they're monoclonal antibodies, and the side effect profile is really good. Local reactions to at the injection site is the biggest side effect. And I have several patients on them now, and the data really does show that they decrease the frequency and severity of migraines in patients who are chronic migraineurs. It's a huge breakthrough. There's lots of drugs in this class kind of coming up the pipeline right now. I believe in the next year or 2, we will have CGRP drugs indicated for abortive therapy of migraines. But again, this is another one of the women's health issues that I talk about, where women are not getting adequate care. We're missing women. We are not doing a good job treating them. And you should really, if you're a headache, experiencing recurrent headaches, please talk to your physician, because we've really made progress and the drugs on the market are highly effective and safe and will help you. So please talk to your clinician.